my specialty is integrative medicine. It's really an emerging specialty that I think is going to push medicine into the future. Integrative medicine is characteristic of a branch of medicine that looks at people first and foremost as a whole being, instead of specializing in one area and just really focusing down in on one particular organ and losing the forest for the trees, so to speak. Lose the sense of the whole person, which is just critical. One of my greatest mentors always told me it's better to know the patient that has the disease than it is to know the disease that has the patient. And I really took that to heart, to know the patient, because the patient really brings the answers to the table as I'm sorting through their story, listening to their story, and giving them that space to tell their story. That's just a key component of integrative medicine. And then after listening to a person's story and collaborating with them as part of a team, not going in with the big guns first, i.e. medications, which has a lot of damage, just fallout from all the side effects, and you have medications on top of medications trying to treat those side effects. And so integrative medicine really emphasizes that lifestyle approach, and starting out with behaviors and how one lives their life, and what's their sleeping cycle like, and nutrition, what's their eating habits like, and nutritional supplements, and then herbs and targeted amino acids, all critical tools to use first before you just throw a big-time medication at a person. And Dr. Amen's approach is the same way. So being an affiliate of Dr. Amen's clinic, it really kind of validates the whole integrative medicine model, where he approached it from an integrative psychiatry model, and I'm approaching it from an integrative whole body model as well. So when a patient comes to me, for example, I had a young woman in her 30s the other day, and she had hormonal dysregulation. Her period was all over the place. Her mood swings were up and down. She couldn't focus. She had a very successful career, now couldn't focus in her career and felt like she was losing a step. And sitting down with her, listening to her story, we were able to see what were the essential elements playing into this mess that was being created, this chaos that was coming about in her life. And we were able to see that she was having blood sugar dysregulation, for example, from her dietary choices, and how she was managing her stress. And she had a tremendous amount of anxiety, and it was hard to figure out where the anxiety was stemming from. She felt like there was no additional stress. She had been handling everything, and so what it was originating from was really perplexing. And after sending her to Dr. Amen's clinic, the imaging was able to shed light on one part of the brain that wasn't clear just from the clinical history. And so it's just another tremendous piece that we have to bring in to the equation and put it out all on the table, see what makes sense, give a good, thoughtful, targeted approach, and it's just, it works fantastic.